Good morning, everyone. I'm Jennifer Kuhns, one of the reference librarians at the Haverford Township Free Library. And today we are having a COVID check-in, which is a brief informational session around the progression of what's been going on for the past 4 weeks. I'm going to try to give you some updated information, some a little more localized information about the virus and what's going on in the state and in the county and in the township. And I'm going to tell you where I'm getting my sources from. And then I'm going to talk about masks. So this is our maiden installment of this. If you have any questions that you'd like to ask me, you can certainly email reference@haverfordlibrary.org or call us at our number 610-446-3082. Leave your question on our answering machine, and I'd be happy to try to answer them next Tuesday. So and I'll post the contact information after this on the website. So the first thing I'm going to talk about is where I am getting my information. So I subscribe to several newsletters, one of which is the Johns Hopkins Center for Health Security News. And that is a resource that is designed to respond to situations such as these, which is a public health crisis. And this organization is made up of scientists, geneticists, legal experts, public health experts, and they all get together and they aggregate information. They track the number of cases, the number of deaths, testing, all kinds of public health stuff. And they aggregate it, and then they send out a couple of emails every day, actually. And so I get my information from there. They're also in contact with the WHO, the World Health Organization, which is our global public health organization, as well as the Centers for Disease Control, which is our national public health organization. The other sources that I use are the New York Times coronavirus newsletter and the Philadelphia Inquirer daily coronavirus newsletter. Those sources, part of the reason I use them is that they're free. And right now they're offering these newsletters for free, which is great. And also I follow the New York Times because of its reputation as award-winning, fine journalism. Some people might perceive that as being a little left-leaning. Maybe it is, depending on where you stand on certain things. And I'll talk about that a little bit later. The Philadelphia Inquirer I follow because it's more localized and gives us a more local picture of what's going on. So those are the major sources that I follow. I also do follow NPR because they are largely non-commercial and listener supported. They do have some larger organizations that support them also, but they can tend to be more transparent and more less affiliated with any commercial enterprise, which sometimes confuses things. So I wanted to show you briefly, there is something called a media bias chart, and you can find this on a website called Ad Fontes Media, which I'll post later. I'll post the link for that. It was founded by a woman named Vanessa Otero, who aggregates, she collects via algorithm information on lots of media news outlets, many newspapers, news shows, all kinds of things. And she also gets feedback from all kinds of people, left, from the right, giving her information, sometimes via algorithms, sometimes via other methodologies. And she has a very transparent methodology that she explains how she gets this information. So there's nothing sort of hidden or anything, no secrets. And I'm going to show you in this very high-tech way how she has come across. This is the latest iteration of this. So you see at the top here where the green is surrounding, these are considered the reliable sources for news. For just news, and it's AP, Reuters, and the Weather Channel, which is the most sort of neutral that you can get is weather, pretty much. And then further down, you have news sources that are reliable for news, but also offer opinion pieces and a lot of analysis. And that's considered, you have some left-leaning, some right-leaning, but just so you know, I mean, that's just information for you to keep when you look at these sources. To the side here, we have these areas which are news sources that are more, have some hyper-partisan content, maybe, some partisan content, some maybe some extremism. And then at the bottom, this red, are news sources that have a lot of extremism, a lot of hyperpartisan, yeah, however you say that word. So this is like real right-leaning, this is real left-leaning. In the middle you have, so this is considered sort of neutral. This is like the National Enquirer, which is an equal opportunity, goes either way in terms of, but it's extremist. So anyway, so that helps inform how I find my information, and lets me to be more knowledgeable about where I'm getting my information from and what might be, if there's any bias behind that information. And also I have to be aware of my own bias when I'm looking at information, so there's all kinds of stuff to consider. Anyway, I had to give you that information as a librarian. So now I'm going to give you some information about the coronavirus, different ways people are, that seems to be the most popular media title for this disease is coronavirus or COVID-19. Technically it's SARS-CoV-2, I think is another way that scientists refer to it, because it's part of the SARS group of diseases, severe acute respiratory syndrome. So, so as of yesterday, April 13th, there were about 530,000 cases in the United States, and about 20,486 deaths. So the Johns Hopkins Center for Health Security is reporting 7,000. Sorry. I'm going to say it again. Okay, so 557,590 U.S. cases and 22,000 deaths as of 9 a.m. So actually, that's actually the accurate count of the U.S. deaths is, as of April 13, is 557,590 U.S. cases and a little over 220,000 deaths as of 9 a.m. yesterday. As of yesterday, there were a little over 1,700 cases, positive cases of COVID-19 in Delaware County. There were 41 deaths in Delaware County. Haverford Township, there are 83 confirmed cases, no deaths at this time. So that's just an update, and apologies for the confusion at the beginning of that. I do have some trouble saying large numbers. So I'm going to talk a little bit about masks, because we've gotten some conflicting information. About a month ago, everyone was saying, don't wear masks. They all need to go to the healthcare workers, and that is true. They absolutely do need to go to the healthcare workers. These N95 masks, which are the thicker masks, and they are able to filter out really small particles. 0.3 micron droplets cannot get through there. There are also surgical masks, which are these more flexible masks that are often pleated, and those aren't quite as protective as the N95s, but they also need to be reserved for healthcare workers. So we regular citizens don't really need those masks. The surgical masks, if you're an essential worker, so somebody who works in a grocery store, mail carriers, delivery people, those folks should have the surgical masks too, to help protect them. Give them a little bit of protection, and maybe help others be protected from them if they're carriers of the disease. So, however, so recently, most states, and also from, I think the federal government has been suggesting, CDC is suggesting that everyone wear masks. And this is more as a public health measure to protect our overburdened healthcare system. and also to protect others if you are symptomatic or asymptomatic, and if you're somehow carrying this disease. It's been shown that up to a quarter people who are infected with COVID-19 are asymptomatic. So you could feel absolutely fine and be walking around and be unwittingly transmitting the disease to others. Even just when you talk, air droplets come out and little virus particles can come out of your mouth and stay suspended in the air. If you're close to someone, they could conceivably catch the disease. And that's really the major way that people are catching COVID is through contact with other people. Not so much like surfaces, although it's important to wash your hands after you've been out and about, but it's really this person-to-person contact, which is why the social distancing is so important right now. So in terms of mask wearing for just the regular Joe like you and me, Tara Parker Pope, who's the founding editor of Well, which is a consumer health site for the New York Times, wrote an article called The Case for Masks, which was recently published yesterday or a couple of days ago. And she just goes through some information about masks. First and foremost, it's a symbol of social responsibility. So we're all on the same page, and we're kind of modeling that this is an important thing to do for the public health, which really comes back to protecting us. It's protecting our public health system. It's also protecting us. And some people are talking about like, well, why don't we wear masks for the flu, or why do we have to wear masks for coronavirus? And there are differences between the coronavirus and the flu. The major difference is that coronavirus is a novel illness. So our bodies have no experience with this at all, whereas the flu, humans have experience with influenza. Many of us have been vaccinated, so we have immunity. There is a large level of immunity in our species to influenza. So we're not going to necessarily be overwhelming our healthcare systems with people who are getting ill and need to be hospitalized. Yeah. So, and the other thing has to do with transmission. So influenza, there's usually a season. The season goes over a period of months as opposed to a period of weeks. For COVID, really infected like large numbers of people within a period of weeks. So the contagion is extremely, extremely quick, which also can overwhelm our healthcare system. And we want our healthcare system to be in good working order so that if we're sick or our loved ones are sick, they can get the help they need. So I talked about how, about a quarter of the people who are infected feel perfectly fine. So there's asymptomatic people who feel fine. And then there are also pre-symptomatic people who could also be transmitting the disease, but they don't have symptoms yet. So these are other good reasons for all of us to just wear a mask when we're outside to protect others, because we don't know if we're asymptomatic or pre-symptomatic. And a recent study published in Nature from out of the University of Hong Kong showed that these sort of homemade masks that maybe not fit perfectly, made out of cotton, are definitely offering some protection to others if you are wearing them, and can give you a little protection yourself as well. So the only danger of wearing masks is that, for the regular person going out and wearing masks, is that it might make you take more risks, and you might forget to do the other things that are really important. It might give you a false sense of security. And we still need to be practicing social distancing, washing our hands at strategic times, like after you've been out to the store or out and about. It's good to be washing your hands when you come back inside. Sorry, I'm looking at my notes. And your mask also makes everyone else's mask look normal, and everyone else's mask makes your mask look normal, so you don't look weird, and the stigma around wearing a mask is not as great. So that's why another reason that everyone's being encouraged to wear masks when they're outside. In terms of exercise, so if you're out and there are not a lot of people around, you're walking, you're taking a walk maybe early in the morning, or you're in one of the parks. I know I've been to the Ridley Creek State Park, and they have a really wide walking area and biking area. I haven't seen, some people are wearing masks and some people aren't. There is not a lot of evidence so far from what I've read to show that runners necessarily, they're running fast. If you're 6 feet away from them, it's unlikely that they're going to infect you. However, for the reasons I just said, it's still good to wear a mask. There are different ways you can get around that if you're a runner, because you really need to be able to breathe. So there are thinner materials that can help somewhat protect others. If you're running, you can sort of make something out of a bandana or one of those headbands that then you can fashion around your nose and mouth. I've seen people do that. Okay. The recommendation still is to wear masks at all times when you're outdoors, because we really don't know who's contagious and who isn't, and it also sends a message of, again, social responsibility. So I talked about N95 masks and surgical masks, and those really need to be reserved for healthcare workers and frontline workers, EMT. Also, to some degree, the surgical masks are for those essential workers who are in the public, the delivery people at your supermarket, especially at the drugstores. But for us, any face covering is better than no face covering, and there are a lot of options out there. So there are these people called aerosol scientists, and they're having their day in the sun right now, because what they do is they study what happens when we speak or cough, what happens to those air droplets when they come out, and how those air droplets relate with different kinds of materials. So cotton, flannel, different layers of cotton, different if you have a layer of something else. And they're measuring by micron, so there's that 0.3 micron level that's really important for the healthcare workers and that the N95 masks offer. And then there's the 1 micron level, which is more along the lines of the surgical masks. And you can reach that 1.0 micron level with certain materials that you probably have at home. If you want to really be fancy, you can also reach the 0.3 micron level if you layer stuff and use some fancy things. So there are many websites, videos right now that are out there that can show you how to make a homemade mask that you can either sew or just cut in strategic ways and then make little ear flaps. So, and I will post lots of links to let you know how to find these things. So, so here's some possible materials you can use. So t-shirt, you can cut along the bottom of the t-shirt, fold it over, make a couple of other cuts, and you have something that has the ear flaps. You can actually tie them, which gives you a little bit of a better fit over your nose and mouth. You can also make a couple of cuts on a crew sock. I saw a video for that, which was really cool, because it's very easy to do, and I can do it, and I'm not very crafty, and the sock one was really easy for me. If you're a quilter and you have quilting fabric, that's more heavy duty, and will give you more protection, and will filter out more air droplets from you, and when I say give you more protection, it's going to give other people more protection, and it might actually offer you a little bit of more protection also. Tea towels. So that's not the terry cloth kind, but it's sort of the more densely woven linen tea towels that you might get. A lot of people, if you go on vacation to Cape Cod and then you go to one of those gift shops and you get a tea towel that has lobsters and crabs on it. It's those type of tea towels, and you can make masks out of those. Those offer more filtration. Flannel pajamas, pillowcases. There was one study that showed that 2 layers of pillowcases gives you a lot of protection. There's one study that showed that 4 layers of 600 thread count pillowcases achieves that 0.3 micron standard. That doesn't mean that if you do it at home, it's going to do the same thing, but a study showed that when certain people did that, that it did offer that. So you can always give it a try if you want, if you have a lot of time on your hands. A lot of people suggest putting a layer of paper towel or coffee filter, depending on the type of paper towel. There's some paper towels that are actually more tightly woven. You can put a layer of paper towel in there to offer more protection. Also, like if your nose gets runny, or it keeps your masks from getting too nasty. Scarves, bandanas. Bandanas are not as recommended. It's better than nothing, although the bandanas do not offer a whole lot of protection to other people and very little for yourself. But again, it's better than nothing. If you have a scarf, if I were to go out, I could just like do this and sort of fashion it under my nose, under my glasses actually. If you have glasses, it's helpful. And this will offer something. If you have more of a winter scarf, that would probably offer even more protection. But not so comfortable when the weather's really hot. So, what else do we have? Also, some scientists are working with air filters to try to help make masks for healthcare workers. You have to be really careful with air filters. Don't try this at home because there's some dangerous fibers that can be released when you cut them. And if you inhale them, well, then they can really mess up your lungs, and you especially don't want that these days. Also, apparently, some vacuum cleaner bags, they can be considered a good option because there are HEPA filters. However, some vacuum cleaner bags have fiberglass in them, and that can also really damage your lungs, and you don't want that. So that is information about how to make your own mask, and the sun is coming up, so I'm trying to move this. What else did I want to add? The most important thing that I'm hearing right now is that widespread testing is really, really important. And the more information we have about who is infected and who isn't, and who actually even might have antibodies, that's another test they're working on, which shows that you had the illness and your body has enough antibodies that you are now immune. That can help us sort of people get back to work in a kind of phased in way. And one of the reasons that there are a lot of reasons that there are issues with testing, and one of them is just aren't enough tests and to go around, and then the other is that the tests are not the easiest things to, if you've read about it, they're kind of nasty. It involves a very long Q-tip that needs to be like stuck way up your nose, and some people have described it as touching your brain even, and you also have to get enough virus to give the correct information, and there have been actually quite a few false negatives, which is another rationale for wearing a mask, because some people are tested and they're negative, but they actually could be positive because there just wasn't enough virus at the time they were tested to show up on the test. And because we're also low on healthcare workers to administer the tests, some of the people being, they're volunteering their time, which is fantastic, but they may not be as skillful at administering the test. So, I mean, I wouldn't want to stick a long Q-tip up somebody's nose. Anyway, that's why I'm not a healthcare worker. So those are more reasons to wear masks until we can get more widespread testing and get more information. So that is some information today about coronavirus, COVID-19, masks. If you have any additional questions, please let me know. I'm going to post lots of links for you to follow for mask making. And thank you for joining me today, and look forward to seeing you next Tuesday. All right, bye-bye.